Hello, and welcome back to the Optimized Equine podcast. In this episode, Vanessa and I spend some time chatting about our recent clinic in Linden, Arizona. We discuss several of the case study horses that we looked at and some of the interesting things that we found in working with them. I hope you enjoy the episode. Hello, Vanessa. How are you today?
Good. How are you?
I am splendid. A beautiful day here in Linden.
Yeah, and what's your temperature?
It's actually a good question. What is it? 81.
That sounds really nice.
What about your temperature?
Well, hold on. I'm gonna say it's 100, but let's just 96. So nice cool autumn day in Tucson, Arizona.
Well, we are almost a week out from our lovely little clinic up here in the Pines. Sad that you're not still here.
I know,
So
we had fun.
in our morning, we just covered some basic information and techniques that people can take home and use in a variety of different situations. But in the afternoon, we did some case study things where we took a little bit deeper look at some of the horses there. And I think had some interesting horses, that's for sure. We knew that
Yep.
going into it. And I think in some cases, we ended up kind of going directions we maybe didn't know we were going to go with some of those horses. But yeah, the first one we looked at was a older horse. He was 20, I believe. Sweet boy, and he presented with one leg that they knew was a problem, a stifle issue was a problem that they had treated. Um, it looked like by the time we saw him, there was plenty of things going on, quite a few different things going on. So it was a little hard to at first identify kind of what we were looking at, but as he got moving, to me, and I think for you agreed, kind of the thing that caught our attention the most was a right front that was looking pretty uncomfortable. I know I initially wondered about it being shoulder just because of how much he wouldn't stretch forward, and you
Yeah.
found that he did have pretty good range of motion in the shoulder itself, right?
Well, we did do some Masterson techniques to loosen that up, if I remember. If I remember correctly, there was some restriction there, but I don't think that was the cause. Like you said,
Mm-hmm.
I don't think that was the cause of the. It almost looked like he was toe stabbing. Like
Mm-hmm.
at first he couldn't really extend that limb out. So we did a little bit on the shoulder, elbow, first rib. It seemed like he was stretching out a little better, but that foot wasn't letting him really go the distance. And um, that horse was interesting too, because when he came to the clinic, he would hardly let anybody touch him. And
Yeah.
then by the time he got to the afternoon portion, um, with your help in kind of what did you call it, closing the door, like that might be something fun for you to talk about, because he was just evading. Initially he was evading any attempt to even touch him, which was very interesting. And the owner had said that he had gotten that way after they had treated the stifle, I believe, with some regenerative therapy. And so you were able to handle him in a way where by the time it came to evaluate some things in the afternoon, he let me go right up to him, pick the leg up, check his shoulder, elbow, first rib, palpate some tendons, flex the fetlock, the coffin. Like he let me do all of that. But it was very interesting how kind of standoffish and evasive he was at the beginning of the clinic. So that was even a nice change, just him allowing us to gain more access to his body.
Yeah, and actually, we started the very first time we handled him was before the case studies, was
Mm-hmm.
because it was just doing a basic technique. She couldn't even hardly do any of it because he was not having it. And that's not, to be clear, I'm not in any way suggesting that the work he had done caused this directly, but I think in that horse's mind, he had to have some scary, air quotes, vet work done. And from there, he kind of got to lead the way. From there, it was he's scared.
Yeah.
And there was no great plan on how to show him he didn't need to be scared, So
yeah, and it's
the
hard.
closing the door was sort of like, okay, well, we're gonna show him that we respect his fear and his concern right now, but we're also gonna say we're not leaving. I'm not leaving you, and you're not leaving us. We are staying here, and we're gonna work through this to the other side.
Yeah.
And
Like
it's
very frustrating for an owner too, you want to help your horse, but they keep getting out of it. And so it's like, well, I don't want to push it and escalate or make him more defensive. But like what you found was taking away some of that ability to get out of it actually then allowed us to have the access. Maybe that doesn't work with all horses, like in this particular scenario, but like you knew how to handle that and how to get access. And then it just allowed me to be able to come in and kind of, feel some things. But
I think he's a prime example of how, do we have to be patient in horse training? Yes, patience is a huge deal. However, if you are patient at just the wrong time, you're going to feel like you're banging your head against the wall. That's the thing that can be so challenging about it. Yes, absolutely. I 100% support being as patient as we need to be for that horse. Mm-hmm. But there also is a time where if you're just waiting and doing nothing and just waiting for them, you're going to basically spend more moments practicing being scared than getting over it in a way. You know what I mean? You have to interrupt that cycle. And if you are just patient without being willing to kind of step in and say, like, this is where this ends. I'm stepping in here now. I'll wait. Okay, thanks. I see. It's like a dance back and forth, a little bit of that.
Right.
Because I think if you don't wait and be patient at certain moments, you're going to end up blowing through and maybe even touching or handling or trying to do something to a horse that's mentally like, that's not ideal either. I want him to genuinely find some comfort, but not going to find it without some assertiveness and well-timed patience, we'll say.
It's the timing is like everything with these guys, right? And like kudos to the owner for like bringing the horse, and just she was really you could tell she wants to do everything that she can to make this horse comfortable, to try to figure out what's going on. And even though I think with that horse there were some more things going on that needed more extensive kind of veterinary exploration, I think at the end of it, we were able to, one, get access to that horse through your handling of the horse and that assertiveness and that timing. And, also moving the horse in a way that was kind of, more posturally correct. And what that demonstrated was, that horse still may have some things going on, but dang it if he's not moving better, because you're asking him to move properly and more posturally correct. Like, for anybody listening, obviously you guys can't see what we saw with the horse, but my interpretation was that right front left hind was really a little off. Again, that right front was kind of toe stabbing. There was some, in my opinion, some good asymmetry in the hind end as far as like how that horse was able to push off and bring that leg forward. So you could see it more on that left hind. And normally those diagonal pairs are going to influence each other, right? So it made sense to me. Oh, right front, left hind. Now, whether or not that's because of something systemic going on, because, sometimes inflammation in the feet, which is technically laminitis, that can create issues where, like you've said this before, it's really hard to kind of tell exactly what's going on if a horse is sore on all 4 feet, right? So we kind of talked about, with an older horse, the importance of kind of ruling out some of those metabolic things that might be, creating some systemic inflammation in the feet. But yeah, like this was a chronic thing for this horse. This didn't just come up, right? That kind of what we were seeing in that right front, left hind. Maybe it was because he was compensating for that right hind. I don't know. We didn't see him when he had the right hind stifle injury. And I don't even remember if I want to say that the vet had done some diagnostics there. Maybe there was a little arthritis. I can't remember exactly, but they had thought the right hind was the issue. They treated that. And then kind of months later, or over the course of a few or several months, this horse had developed kind of some wonky ways he was going on that right front, left hind. So we were at least able to then get the horse moving. And because of how you handled him, I was able to evaluate some things from an osteopathic standpoint, and can't say that I found anything that jumped out at me. There was no big pain response in his shoulder, elbow, first rib. Palpated along the tendons. There was a little reactivity, but nothing super severe. Did some flexions on the fetlock on the coffin. Again, nothing that was like very severe of a response when I did those things. So that's where you start to go, again, is this systemic? Is this soft tissue? That was kind of the first thing that went in my brain. Is there something like soft tissue going on in the foot, which is like you almost have to have an MRI done to diagnose those things. And those things can become chronic if they're not moved in the correct way, or they're moving too much, or they're not moving enough. Any of those things. It's all about the appropriate movement, I think. And that's what I loved about how you showed moving that horse. And I'd like for you to talk about that. You moved that horse, you had him go over some poles, and you were asking him with your body to just move in a better way, more of a, like Jillian Kreinbring says, a good banana. So bad banana, good banana. And you were asking him to move better. And like I said, hot dang, if he didn't go better. Did we get to the bottom of the issues? No, like that's vet territory. But we were able to show that with correct movement, sometimes that's the problem. Not all the time, but it can be a factor. And they go better. So it's determining like how much movement, but really the question is appropriate movement. What is appropriate movement? Even if you have something chronic going on. If there's not a big pain response, I'm like, and there's not an acute injury, I'm like, yeah, just like humans, like, and horses, you there has to be some correct movement there for like vascularity, nutrition to tissues. So if you take that completely away and they're just stand in their stall 24 hours a day, it's not doing a service really for the healing process. But then we don't want to go out and like make that horse go 30 minutes in the round pen, just all over the place, unorganized in a bad banana posture. That's going to maybe make the issues worse. But what we found was this sweet spot. And I want you to talk about that.
Yeah, even as uncomfortable as he sometimes looked, just getting him moving on a gentle circle at the walk, and having him step over some poles, it's super simple. Did I do anything super special? No, I kind of just had him do some circles over these poles a few times, even that without starting to think about his back and things, just kind of saying, let's go move over these. I feel like that you could see some improvement. So
I definitely did.
For someone like in her particular case, I know, and she told us there, I know the horse is not sitting in a stall locked up. We know that. He lives outside, which is great. However, he showed us, his way of moving without help was pretty dysfunctional. So even though he's not locked up, he is traveling in that like really kind of odd way that he was. And so the longer that's left alone, even though he's in movement, and that's better than being locked up by far. If we don't come in and kind of help shape it into something better, it's just going to keep getting worse and worse. And then it starts to become, oh yeah, well now he is too sore to go move, then
Yeah.
what? And then you start to get more and more and different problems. So anyway, in his case, doing some circles to help get that spine mobile, get it doing something, so that when I asked him, you can ask a horse to speed up and carry themselves from behind. But sometimes, often without specific shaping or suggestions on that curve, they're just going to speed up those legs. I don't want to just speed up the legs faster. I want to change, and so it pushes the spine from back to front. I don't think I said this analogy on Saturday, which is actually shocking because it's one of my favorites, and that is the boat analogy for anyone who's done any boating. If you just kind of go along in the waves and you don't have enough gas, pushing your boat, you're going to just be like flying through the waves like this. If you have enough power, your boat comes up and you get steady and you ride up above it. So if you're not a boater, that may not mean much to you. But for anyone who's done any boating, that's exactly kind of what we need them to find, is enough push and not just speed to get that back to where it can do normal oscillating movements. In his case, I think there's a lot of reasons I think he may have had those stabby movements, but I mean, that back, when he's walking in that stabby short way, it's literally just, it is a bad banana. It's hanging this way and just doot, doot. It's all leg. There's no fish flow with the motion there. So by just asking him to get going, get going somewhere a little bit, I think the curve is important in that case for that horse. I say that carefully because I definitely think circles and curves can be really, really overdone and really poorly done. And there's plenty of information out there about doing too many or how bad circles are, and they can be if not done in a certain way.
Well, like for the quality, right? Like for the quality of it, which is what you were going for. Sorry to interrupt.
Yeah, that's okay. No, it's definitely the quality of what you get. And I think one of the ways to know if you're getting to something that you should continue to work on or not is like if the horse is getting enough flow on their curve or on their circle that their head can just kind of hang there, and you're not seeing this like the head's like pulling them through the walk, that kind of thing, then your circle is a good thing, because that head won't hang like that unless the back is doing what it needs to be doing for a healthy motion. So that's something I'm always looking for. So anyway, I personally think circles and curves are like a vital part of what horses need to mobilize. I just think they really bad rap, but I also totally get why they get a bad rap, because it's really easy to do it poorly. So anyhow, once we put him on a, you're talking banana about a back like this, I am often talking about the banana around the circle as well. So that other plane of things. In his case, it's kind of like find a little tempo and then help him figure out how to move that middle, how to get that middle going enough to loosen it up. And then from there, he just moved better.
Well, and I'm like kind of doing this with my body, because when you're talking about engaging that hind end, it almost creates like a someone who's ice skating, like this figure eight kind of pendulum motion through the body, which is going to affect their bending this way, side bending. But something you said made me think of something that I learned in school, which was the morphology. So the natural curves of the horse are such that their spine in more of in that flexion extension, not so much side bending, but in that flexion and extension of their spine, they move hind to front like a bullwhip, kind of like that, like you're talking about the boating. I feel like it's kind of like that, or a
Mhm.
springboard. So that energy kind of transmits from the hind to the front. And so you've got, you've got in a plane movement like this, but you've also gotten a plane movement like this, which is more bend and rotation. And so all of that has to kind of be fluid and bracing, um, pushing from behind, transmitting that energy forward for the horse to really, be able to move correctly. And the hard part is like what you were saying, when horses are turned out, for instance, sometimes they don't move. Sometimes they just stand there. And other
Mhm.
times they do move, but they're going to move in a way that's easiest for them. Like I know from me, like going to PT, um, it's that neuroplasticity approach where you have to do something so many times consciously and it doesn't feel comfortable because you're not used to moving that way, for you to get to a point where you're moving unconsciously your body in a more organized way. But if you were to just say to me, go do this, and you're not helping me by telling me, then as a human, I'm just going to move the way that's easiest, which is the problem, because normally it is dysfunctional. And I'm going to put more strain on my joints, in particular joints, which can then lead to injuries. Now, horses, you can't say, when you do this exercise, do it like this. So you have to help them. But my point is that when you say, like, we need to help them, absolutely, because they're not going to move different unless we ask for that. Otherwise, they're just going to do what's easiest, which is not always what's posturally correct, what's going to preserve them. And they can also go through that neuroplasticity process where they make new pathways here, where they organize themselves in a better way. But because you can't tell them that, you have to prompt them to do that the way that you were in moving them.
There's I wish I had the quote. I don't have the quote itself handy, but I will paraphrase, and I believe it was Chase Jarvis. And he's talking about humans, but I mean, absolutely, I think even more so on horses because they're not going to sit and learn about optimizing like we might. And it's essentially saying how like our body and our nervous system and our brain is so amazing and it's so designed to do all these things that are so amazing, but at the end of the day, it's for survival. It's not necessarily
Mhm.
wired for us to live our best life. You know what I mean?
Yeah.
It's about
Yeah.
surviving. And so that's why, without something coming in and being specific to help you, whether it's your own, in our case, our own research or whatever, your body is going to do the workaround for your comfort and survival. But that's not necessarily the best option. What is
Yeah.
the That's a big question. You
Yeah.
know what I mean? But I think that's an important thing to remember. Like, truly the best is not the same as surviving. You know what I mean?
Exactly.
Different
That's
A different
right.
prioritization in what needs to happen. And like that is perhaps you could say why that first horse was getting so defensive. His brain is just kind of like,
Mm.
oh, this scary stuff happened and it's hurt and it's been hard, and nobody ever broke through necessarily and said like, no, you're in physical therapy now. I think let's just chill out a little bit. His brain's kind of stuck in that like, I gotta survive. This was
Yeah.
painful. I don't
Yeah, and
know.
you don't trust your body. You don't trust your body. Like, I'm sorry I keep talking about me, but like, you don't, like, I have an old knee injury. So I don't trust my body sometimes to use that the way that is going to be better for me to just walk. I'm going to put more strain on my hip. I'm going to put more strain on my ankle. And it took going to PT for my, she's amazing, to make me kind of go through the paces to where I could trust my knee again. And you have to be shown that through, like with horses, the work that you do. Otherwise, they're just going to keep, moving in a dysfunctional way to protect themselves because they don't trust it. And I mean, if there is truly a pain response there, a true discomfort, of course that makes sense why you would avoid using one joint. But that's where, again, where we talked about with this horse, just maybe diving a little deeper, finding a veterinarian that could go a little deeper, do more diagnostics to try to get to the bottom of this. But you found that sweet spot in movement where just asking him to move, in a way that was more for optimization, it showed him that he could do it. And second, it's gonna make it so that he doesn't keep degrading and deteriorating other parts of his body.
Yeah, he needs to move that way now, and after, if they find what's wrong with him, he also still needs to be moving this way. And in his case, I think it's pretty clear he needs to have some more diagnostics to figure out some of what's going on. But I mean, it also could be interesting to just do the good movement and see where that gets you. So at least then when you do get the diagnostics, kind of what you maxed out. I guess that's one way to put it. You kind of know what you can max out from the motion. I feel like that's
great. I like that.
A wall I have felt before. Like when you're kind of rehabbing a horse that's got a lot of things going on. Some of the off the track thoroughbreds I think of, you know what I mean? There's got so much going on when you start, and you go through all this stuff and they figure out how to move, and then you sort of are left with like, okay, this is what we got left, and then go diagnose. Whereas on some of those, had we gone diving down the vet path very deep in the beginning, it's hard to imagine where it might have taken us. And that's not because a vet is misdiagnosing anything. They're just diagnosing the stuff that's in front of them. I just think a lot of what the stuff they're seeing in front of them is healed through the moving, really. You know what I mean? And so it's like, see what you can get from that part, and then see what's left.
I really like that. Yeah. And you've done that with at least, a couple horses in particular that I remember when you were in Mesa and I would come work on them. Cause like this owner, like she had done what she could, she had, it's not that she hadn't tried. It's just that, it kind of, the vet thought they found the issue, and it may have very well been an issue, but then things changed. Then patterns in the body changed. And I really like that idea, like you said, maxing out, like because like you said, even if you get some other diagnosis, you're still going to want that horse to move in the way that you were moving that horse. And that's the part of it that isn't always there. The mindset of this is physical therapy, this is rehabilitation.
So anyway, where were we? Our second horse we worked on was a mystery horse that I had personally met before several times, but you had not yet met him. He was one that had an interesting history that she found out about a little, after buying him. And he, in my experience with him prior to the clinic, is just kind of, gets bronky, let's say. And so I know I was going into it curious to know what you would feel in him. And I felt like you felt some things, but nothing that felt like, this should
screamed at me.
This should be causing that big of a reaction. There was definitely some concerns, and I know she'll be exploring that stuff when she gets to her side of town for that. But he had some things going on in his neck that we could see when I moved him. We ultimately found that was the thing that made it a little better. Didn't shout neck to me at first. but nothing we found was like, oh yes, this could be a serious thing.
Yeah. And I mean, like, anytime the horse is bronky, it's like, okay, well, does the saddle fit? Okay,
Mhm.
that's always a big concern, right? Or one of the factors. Is there a structural change in the spine, like kissing spines, for instance? You know, that's kind of one of the first things anybody thinks of when they have a horse that is all of a sudden bronky or explodes under saddle. Sometimes gut issues can create that kind of response. So yeah, what I thought was interesting is I got to evaluate him a little bit osteopathically, and his sacrum had a restriction on it, which would cause his spine to bend to the left, I believe. It was one direction or the other. And then when you go through and you check the spine, you're like, well, his sacrum's telling his spine to bend this way, but actually it bends better the other way. In osteopathy, we call that a decompensation. Those hurt. They don't feel good because it's like conflicting fascial pulls on those bony structures. So he definitely had that going on. But I felt kissing spines before. And I'm not an x-ray and I'm not a vet, but I did not feel like I felt big structural issues. What I found was more of, again, conflicting fascial pulls, and mostly because of what that sacrum was doing and then what that lumbar was doing, it wanted to do the opposite. So that's, again, more on a fascial level, not necessarily like a structural level. So that was like, yeah, this isn't screaming at me, like,
Mhm.
oh, kissing spines. And he wasn't super sore in his back either. That was
Mhm.
also kind of interesting. He didn't have a lot of muscle tension when you go and palpate the back. What we found with his head and neck, which was interesting, is you started moving him, and I was kind of looking at his hind end. But you're like, no, like the head and neck. And he had a real difference in how he would go to the right and how he would go to the left. To the left, he was like more evasive. He wasn't really bending. He, especially up in that head and neck, he was almost kind of like doing this when you're asking him to go to the left. So you're like, Vanessa, come here, like, look at that. So we did just a gentle mobilization of his pole because he could not bend to the left as well as the right. So we did that, and then you worked with him, and then again, hot dang, if he wasn't going very much improved to the
Mhm.
left, just from the little bit that we both did there.
It's interesting with him. I think it's a little different because I had worked with him previously and you'd never seen him before. Um, it's interesting because I know how he looks at home. I
Mm,
think at home, his hind end does catch my eye, and I go, and me and her have definitely talked about like you might have something arthritic something going on back here. Again, we've also said I don't think this is why he is exploding, but I do
right.
think there's something going on, and it seemed like certain times would be more stiff than others, or he would need more, let's say, help working out of it than others. Um, and perhaps this is just him being away from home, even though he seemed quite calm. Was this his like adrenaline away from home? To me, as far as his hind end goes, he actually looked, I thought, better than what I sometimes see at home. You know what I'm
Hmm.
saying? So it's,
Yeah.
having that reference, perhaps that's the reason why it didn't draw my eye, because it actually kind of looked better than it
Okay. Yeah.
sometimes does.
Gotcha.
I don't know. So that's interesting, but I definitely think, whatever is there in the hind end, I'm sure is something, and that is to be explored, and that's something her and I have already worked on a lot of. Like, yeah, the more you can get him to move better, if he does have arthritis going on back there, which she's about to go explore in her X-rays,
Yeah.
it's this is going to be a good thing for him, getting him to move like this. Um,
Absolutely. And you showed you could get him to move better. Like as you worked with him more, we did little twerks. I think I adjusted his sacrum, I adjusted some of the lumbar. I did just that pole mobilization. And he was more fluid and bendy to both sides, but especially to that left. So again, it just showcases how the way that you're working with the horse to get them to be more fluid in their bends, and also just keeping their nervous system kind of in a steady place.
That's
Okay, yeah,
probably
we
the
know he has
important thing to
issues,
bring
but
up on that one is
yeah,
so this is kind of more of this piece of the conversation will feel more like a training side of things, but I think it very much applies to what you just said, and that is, as you may recall, when I was moving him in between things, there was a point where he was getting quite stuck, and he was just, I'm saying, hey, can you go out to the left? He's just going backwards. He's just going backwards.
yeah,
Now, several times in a row, he is going backwards, and I'm saying, hey, let's go off to the left. Can you yield your shoulders? He says no. Okay. Now, I think in a lot of training styles, there's absolutely ways uh, that you could get a horse to yield from me faster, more responsively, more respectfully, some might say. Okay. Um, and maybe I even would choose to do that. But in this particular horse, knowing what I already know about him, if I demand that more respectful yield, that zappier response, get right out there and go, I'm going to take that nervous system to another place.
yeah, yeah,
And so
yeah,
now not only is the training going to be different, but now is he going to let you in to change anything on his body? I don't think
right,
so. So I think
right,
it's very easy to watch what happened in some of those scenarios. Again, I don't know how I would have handled it if that was the first time I met him. I can't make that be true. I already know too much. You know what I'm saying? I knew a lot
yeah,
about him already. I know that horse will get to a place where he will zone out. I would say shut down. That's some people like that term. Some people, I think, way overuse it when it's not needed. But that horse, I would say, will get to where he just shuts down and you
yeah,
can flap, whack, jump, dance, do whatever the heck you want. And he's just like, whatevs. Like, he's out. He's
yeah,
not there. So in that horse's case, he's going backwards, and it would bother some people that you let that go on. Oh, he's just going backwards, going backwards, going backwards. You know what? He gave me an answer, and I've seen that horse plenty of times be completely gone. Completely gone.
yeah,
If you try to get bigger or change something too quickly, he will not move. He will grow roots and stand there. Not just,
yeah,
I'm not saying with me necessarily, but it's a thing that happens with him and his owner. It's a thing that I've seen happen. I understand he'll get there. So I'm perfectly calm, and there's no need to escalate or make a big deal out of the fact that horse chooses to go backwards. I will take backwards over a non-response. I will take
right.
backwards over a complete active, I am going to ignore you, because that's an option that he
Well,
sometimes
because
has.
the way that you did it, you kept a connection with him. And I think that's like, we talk about the nervous system regulating, and I'm sort of relying on the human part of it when I say this, but there's fight, there's flight, there's freeze. And so all of those are dysregulations on a spectrum of that autonomic nervous system between gas pedal sympathetic, stomping on the brakes parasympathetic. So I love that the way you worked with him, though, was keeping that connection, getting the information you needed. And it worked, because at the end, was he, completely symmetrical both ways? No, but there was a softness and a relaxation in him going to the left, and a willingness. It was hard for him, but he wasn't getting stuck in it, and he wasn't shutting down, because you were listening to him and also kind of adapting how you were working with him. Each individual is going to present differently.
Yeah.
So,
And there's, you have to prioritize. I guess that's something that I think plenty of people forget to prioritize. Like, it becomes about, like, oh, the responsiveness is so important. It is important. But there's also times that, like, it's really not going to hurt anything, and there is a little bit of a benefit if you just let it take a few, like, okay, well, let's ask again. Okay, let's ask again. If getting him moving more responsively in that time, we'd have gotten going left sooner. But would we have found out that he was tight? Probably not really like we did. He wouldn't have
Yeah.
been honest, I guess you could say, in showing that.
Right. Exactly.
In
It
showing
was an
that
honest
stuckness.
response.
Yeah.
It was an honest response. And I think that's an important differentiation to make. Yeah, you can get them you can get them to barrel around you to the left, but we want to do it slow and relaxed and an honest connection. So the way
And
you
is it honestly as good as the right? If I'm only worried about like get out there and do it, if that's the
right,
priority, you don't really know. He's just going to
right.
go do it with this little bit of uptightness that hides the little bit of crookedness. Because if you kind of sent him that way to the left and the right, no matter what, he's just going to go, okay, it's all tight. You don't see the restriction in that case. You know what I mean? You only see that when you get to the horse that's like, okay, I'm going, and oh, I'm stuck. You know, like takes that state of mind, I suppose. Which I guess leads us into the next horse I worked on, which
Yes.
was had a different issue, and that was that he was not comfortable enough to really allow. He wasn't receptive, let's say. He wasn't comfortable enough to be receptive to shaping him and moving him and making suggestions about how he was moving.
Yep.
Now, I know that his over responsiveness, I guess we could say, is something that they've worked on quite a bit, but it's definitely still a thing. You know, I think one of the things I said when I was lunging him, on one hand, you know, sure, he's a prime example of, oh, it's no, look how he went out so responsive. He yielded that shoulder, didn't he? That was great. But, you know, I like how go-y he was in a sense, but then it was like, yeah, this is all fear. I couldn't even, I think I said that during the clinic. I can't even hardly breathe without him like thinking it means something and getting kind of jumpy about it. You know, I'd lift an arm and he was moving here and there and so that is, there's no honest conversation we can have about his body. It's not to say there's not a lot of conversations that need to be had, but I think when that is your starting point, a lot of that conversation is just about trying to get in his head so that he can trust us enough to let us do anything to his body. Now, I know you did work on him, and in a body work way, he was letting you do things, right?
I kind of evaluated like his pole in particular and some of his cranial structures, did some craniosacral. The background that the owners gave us was he had switched homes a whole lot, like 7 times or something, and then they got him and they got some diagnostics on him, took some x-rays. He had some cervical structural changes, so in his neck. He also had some changes in his spine, and so the dude had, some body issues for sure. And when I felt his head and his pole and his motion, he was pretty limited. So, some of that plays into that not trusting too, because as prey animals, they need to have that mobility, especially in their head and neck, to be able to detect predators and threats, right? So when the horse isn't as mobile, they're going to get more fearful because they simply don't have the mobility to detect those things. And so,
would you say, real quick, let me interrupt you on that piece. Would you say, I think I would say, tell me if you think it's true or not, like their nervous system won't let them relax because the nervous system knows they don't have the balance and the mobility? Would you say that's...
Yeah, like they can't move it, so it creates this fear because they're not, as a prey animal, they're not able to detect as well danger. So yeah, it puts you, like, if you're compromised in some way, that's going to make you more vulnerable to being attacked. Your nervous system is going to ramp up. You're going to be more in that sympathetic state. You're going to be hyper responsive, as you said. And that's why when I felt those things, I thought I got to do some craniosacral on him because he's so dysregulated right now in that system. But see, it goes hand in hand with what I was feeling. It goes hand in hand with a lot of restriction in the pole and the cranial structures. And then again, those are the structures, and the hind end in particular, that are going to affect the pumping of the cerebrospinal fluid through the protective covering of the spinal cord, which nutritions your nervous system, which protects your nervous system. So that's a little bit compromised, right? We have structural changes. It all kind of goes hand in hand for me. So what you're saying is correct. Yeah, what you're saying is correct. And I just found it interesting that I found so much restriction in those structures that are helping him kind of protect himself. So he's compromised there. Now, what came first, I don't know. But then, you moving him around, it really showcased how, like, it was just really scary to be in his own body.
Yeah. Yeah. And I guess if you think about if he's that reactive from that very little, I mean, I certainly was not getting into anything, or trying to get into anything excited. We're just saying, can you go walk a circle?
Right.
And then that was kind of like, no, it's getting pretty amped up pretty easily over very, very, very minimal things. If that is something, now we're away from home. I know it's not the same as what his day to day may be like, but I think anyone that's that much on edge, if they're kind of always stuck on edge like that, it sort of doesn't matter what came first or how you got there.
Right.
Like, nothing can get better from that place now that you're there,
Right.
If you go, even if, he did appear to me to be pretty relaxed with you in some of the bodywork stuff, but
yeah, that's true.
It doesn't matter how relaxed he could get or what he allows you to do in a moment, if the next moment or the next day or the next every day is him being this other way, overreactive over every little thing, what could stick? I mean,
Totally.
Yeah.
I mean, yeah, from a bodywork perspective, if his nervous, like, I can try and help his nervous system. I can try and help get some things moving better. But at the end of the day, if he still has this kind of baggage from the past, or he has this compromise in his body, which doesn't allow him to be an optimized prey animal, which is to detect danger, tissues are going to contract again. Things aren't going to stick because his nervous system is so out of whack. And, like, just to say, like, in a couple of the Barrett classes I've taken, Barrett is the osteopath who discovered and created visceral osteopathy for humans, which can sort of be translated to horses. But anyways, like, actually moving tissues and structures and fascia and even organs. It doesn't matter how much you do that. If at the end of the day, the person is still super stressed and throwing their autonomic nervous system off, which is what is regulating all of your internal processes, it's not going to hold. And I have to think that's the same with the horse in the way that you're describing it. And so, like, him having so many owners prior to coming to these nice folks, there was probably some training approach there where they kind of encouraged that hyper response. I would imagine the horse didn't feel safe. Maybe repetitive motions or trauma or whatever is going to create changes in the body structurally, because that's what it does. It lays down extra material in areas where there's strain. And he was relatively young, I think, he was only like 8 or 9, I believe, to have all these structural changes. Here's the thing too, when you're super stressed, you're not respirating correctly. You're not breathing. So you're not getting out the carbon dioxide and in the oxygen. So then what does that do to your body? It makes it more acidic. Well, what does that do to your joints and your tissue? So like for me, from a bodywork perspective, I need to help this horse, yes, but the other component of it is then the interaction of horse and human needs to be worked on in a way that you work with the horses so that he can feel safe. He can feel like he can relax. The other thing, interestingly, if I remember correctly, I did just some field of vision kind of checks. And I don't think that peripherally, I think he had a little bit of a deficit. So again, being a prey animal,
Mm-hmm.
how is that going to factor? But
Yeah.
you can do all the body work to try to make them relaxed. The field of vision stuff is optic nerve. Depending on how long those pathways have been compressed, you may or may not be able to make changes there in the transmission of that nerve. But if every time he has to work with the human like you were, he's getting amped up, it that has to be there too. That component has to be there too. And those folks, God bless them, they have tried a lot of things, and they've did the diagnostics. And I love that they brought him to the clinic, because then the holes could really show. It's like, yeah, we have a dysregulated nervous system and we have some structural changes, but we also have a lot of fear and baggage around just going in a circle.
Mm-hmm.
Right. So like all those things need to be addressed if we're going to
Yeah.
truly rehabilitate this horse. And so kudos to them for bringing the horse and seeing what we could do.
I think on that one, I'll say, like, on a training side of things, it was tough because, if I were working with that horse in a round pen,
Mm-hmm.
I would have done different things. Or even if I was in an enclosed arena, but we're in an arena that didn't even have a gate.
No, I know. Yeah.
We're in an open arena with chairs and pop-up tents and people all around and all of that. So
Yeah.
that definitely, not that I'm not looking for a rodeo, but I do suspect if I do think that it would be beneficial to have kept moving that horse and gotten him to the other side of that fear. Because I think the way that I needed to address it that day in that location, we kind of had to we just had to not go there. I just don't think it would have been
Totally
a safe scenario to go there. But in a different setting, I do think that the best way likely to get to the other side of that is to go through, like, the training side of things enough, which would include going through the moving and just getting kind of like, the way that we were saying on the first horse, when he wasn't sure about someone approaching his sides. We found a way to kind of say, hey, you know what? It's okay. And I'm here and you're there and we're going to get through this. It would be that exact same feel of conversation with this horse, except this horse was so reactive that there probably would have been some big things going on. And that's fine.
Right.
Now, as long as you're in a setting where that's safe
Right.
to do.
Totally. You were totally limited.
I think that's important to bring up, that we did choose to not continue moving him that day. That doesn't mean that I think moving him is the wrong answer.
Right.
But it was there, because him getting loose or something wasn't going to be doing anybody any favors.
No.
Yeah.
And like, just to add on, like, I think a fear is a fear until you face it. So, that's where confronting, however you can, as a trainer, as you can get these horses to confront that's kind of integral. Otherwise, the fear is going to overtake everything and overtake access. It's going to cause disconnection. So what I loved is that the owners were so like, what can we do to help this horse? And it sounded like they really wanted you to come out and keep working with them, because, even though we know we have all these structural things, again, the movement is the correct movement, the correct connection is only going to be beneficial. And I loved that they were so open and willing to try and help this horse, even though he has these things, right? These structural changes. So hopefully they will, have you out and you can then work with him in a better setup, because obviously, like, if he would
It's
have gotten loose, that would have been very bad,
I suspect that he would be one, I mean, different certainly than some of the off the track thoroughbreds, but I suspect it would be the same way. We'd get to where he could move without being so reactive.
Yeah, oh, totally.
And
I can see
then
that.
he would tell us his biggest issues. I feel like right
Yeah.
now he's almost too reactive.
Yeah.
We know because of their x-rays some of the issues he has.
Yeah.
But in a way, I don't think he, at the moment, can honestly say his biggest issue. It's just like,
Yeah.
I think if he could learn to get that piece of it sorted out and regulate in motion, then they would find out from there, okay, this is what's really hurting, or this isn't what's really hurting,
Right, because I think right now the horse is just being triggered
by
everything.
everything. Yes.
And working
it's not
through
funny.
it.
It's sad. I mean, he really is triggered by very small things. So yeah.
And like getting to the other side of that, and like you said, trying to really figure out what's going on. Well, you have to get to the other side of that first. So
most definitely. And even if you could find definitively what hurt, like you said, it wouldn't matter, because if he's constantly that fearful, you're going to keep having things come back. It's going to keep coming back. So
much is about that darn nervous system.
That darn nervous system.
Yeah.
Although we're probably pretty lucky to have it.
Yeah.
Let's see. So last horse I worked with that day was a lovely little lady, and definitely a good contrast to some of the mysterious ones before. Oh, hello, Pesto. There he is. Hello. Anyway, so this other horse was, I believe I called her Gumby. Comparatively, she was, I felt like a really good mix of responsive but quiet. And everybody, I think, is entitled to their own opinion, and every horse kind of has their own way of what is the right answer to that, of how much quiet and how much responsive. People like different things. But for me, I thought that horse had a lovely blend of responsive and quiet and receptive, and maybe trusting is the way to put it. I mean, I had never, and I just grabbed her and started moving her, and she let me change how she was moving. She had some little stuff that her owner mentioned that she had noticed in her hind end movement before, like she was kind of short stepping with that right hind at times. And I know you adjusted, was it her SI that was kind of stuck down on that
her
side?
pelvis. Her pelvis. She, to me, it was, if this is her pelvis on the right, it was actually more like this motion wise. So like she could go what we call dorsal, but ventral was a little hard. So when they can't go ventral, it's harder to push off with that leg and really carry that leg forward. And so it was minor though. I mean, it was really quite minor. And like, that was a horse that I was like, yep, that's all Tamara, because like you said, she was young. She didn't have baggage, she was just really receptive. So yeah, I just found this minor thing, but that was probably a nice one to end on, because too, a lot of the participants had seen, 3 horses up till that point, and us kind of trying to show minor improvements, or even in some cases a significant improvement in just their behavior or their accessibility or their receptiveness or their willingness. And I loved, there was one participant that was like, man, that last horse really solidified it for me. I could see exactly what you were talking about through moving her in a way that kind of got around corrected some of those restrictions simply through moving her in a more of a posturally correct way. That was
Yeah, I feel
lovely for
like
the
with
participants
her,
to see.
we could just kind of go right into the
Yeah.
actual balance work. You know what I
Yeah.
mean?
Oh,
Like, so
totally. Totally. Yep.
when it comes to posture and balance, you know, I know I said that in the beginning. It's like the nervous system is the gateway, the gatekeeper to allowing you to really be able to work on it or not. And I
Yep.
think the first few we worked on certainly demonstrated that. And with her, you know, not a lot of issue there, but and then we could talk about, okay, well, she's 4 and she's
Yeah.
just getting developed.
Right.
So in her case, the easiest way for her to travel was kind of with her front end down a little bit and pulling with those front legs. Um, I thought she moved like an Andalusian, and she said that she did have some Andalusian in her. She kind of
I
like was
thought she was.
really active with those front legs, which can look flashy, but in this case, it's the sign of a horse who's just a little weak and she's just moving, not um, abnormally weak, like a normal 4-year-old horse kind of weak.
Right.
And we want to encourage that she gets that the flow behind we talked about at the beginning. Get enough push from behind, you can get that boat up above the
Yeah.
waves there. And so I think with her, when I asked for a little more power, just there was the tiniest little bit of, oh, this is hard, and I'm going to think maybe it'd be better if I could just leave this circle right now. So with her, instead of staying in a lunging type position, when I asked for a little more for her to find that the amount of power from those hind legs to be buoyant, let's say,
Yeah.
then I ended up coming back and working next to her closer, kind of right by her belly, and helping her like find that that banana on our circle,
Yeah.
so that she, compared to some of the others, her head was just barely doing this little chicken thing, but we could help her get a little more push from behind, a little bit more of that belly going out with the motion, so that her head could just hang, and then she did finally kind of take a big stretch into it there. So
Well,
that was
yeah.
a nice little treat at the end for that when we didn't have a ton of time left for her. I know we ended up going over even a little bit on that one, but I was glad we could just do some balance stuff, and
Yeah.
but
She
I
was a
love
good one
how,
to end on.
yeah, I loved how you could just see her head just sort of. I like the pendulum idea. I want that head to
Yeah.
just dangle there, and when you see that, you've got something good going on. So I like that.
Well, I
That was
love that you
ending.
pointed that out because that was something I hadn't been paying attention to is just like, do they have that like that chicken neck or is there like this
Yeah.
flow? And like she is young, so horses innately are going to dump on the front and not kind of, I don't want to say collect, but they're not going to do that innately. That's,
Mm-hmm.
you know, but that's how we have to ask them to carry themselves if they're going to be ridden and not deteriorated.
Mm-hmm.
Right. So I think being 4, this is all just very typical, right? Like what you were finding, she's still trying to figure out how to organize her body. And so you
Mm-hmm.
could really showcase that. And even maybe that right hind was just, yeah, there may have been some restriction there, but a lot of it too is she's just not organizing her body because she has to learn how to do that. And she has to have help to do that. So that
Mm-hmm.
was great that you were able to show that
Yeah,
with
and I
her.
think on hers, she had mentioned that one of the canter leads was a little harder to pick up, and
Okay.
after you were feeling it, we pretty much were in agreement. Like, yeah, that's not because there's a problem. It's just the
Right.
matter. It's no different than me and you being right and left. If I want to sign my name
Exactly.
just as good with my right hand and my left hand, then I have to practice with that left hand because it's not naturally there, And in her case, I think
Exactly.
that's just all she was, feeling in that canter thing was like, yeah, she's just got to figure out the right buttons to use and when to use them, and that's the thing, where we all know, yes, horses do these like athletic, glorious, amazing things on their own, but they do it when they're inspired to, not like on a push button thing. And we are essentially, we have to teach our horses to still do it that athletically, basically on our request.
Yeah.
You know, we have to inspire them or do it on our request. Otherwise, it doesn't, it's not that athletic way that they have the ability to do. And then it just goes downhill. So,
well, and just one more thing, I like an anatomical thing. Like I love how you're using that boat analogy and how that kind of lifts that front end to where they can ride that wave. There's a lot of, and this is like a little bit of a can of worms and a totally another podcast, but there's a lot of talk and focus on the thoracic sling these days, which is great to talk about that wither, shoulder, you know, low neck, first rib, sternum area where that all ties in. And they're just like hanging in the sling of their shoulders there. So, you know, it's easy for them to do the, as Peggy Cummings says, do the Dolly Parton and, you know, and just like, But, and there's a lot of controversy on like what comes first. Like, how do you get that horse to be that, this, you know, this kind of, not frame, again, not the right word. I like the way you say it better, but what comes first? Well, I think so much of it is the hind end. I mean, the gluteals are the initiators of that push forward. And Lori Muller, who's an osteopath, equine osteopath, and Masterson method practitioner in Texas, she does these awesome advanced anatomy courses, and she talks about the longissimus dorsi muscles. And it's not just one muscle. It's these little, you know, if you look at it in an anatomy book, it's these little tiny bunch of muscles that make up this muscle group. But the way that it functions, it's almost like a crane that kind of picks up that front end. And when you said the boat analogy, I just couldn't help but to think about that. And how important that hind end is and important that push is, and how sometimes horses, well, like we talked about, they're not innately going that way. So you kind of have to show them that way so that they're inspired or prompted to go that way, so they're not just deteriorating on the front and dumping. But I do think that hind end push is a lot of times what allows that front end to get light. And then there are some people that are gonna disagree with me, but I from an anatomy standpoint say I think a lot of it's that hind end.
And from a training standpoint, I'll say this. So if someone's said, here's that. Oh, yes, it's about the hind end. Yes, that's right. It's about the hind end. So now they're putting all this pressure on the hind end and really just going faster and faster and faster.
Right.
But still crooked, or still compensating somewhere, or you know what I'm saying? Like there's not, or they're going, the way that they are saying, or the way their horse receives this cue of, hey, use your hind end a little more or a little snappier. Well, if that scares your horse and now they're tense, that little thing doesn't happen. The crane doesn't work. And that's the same, you know, in the morning of the clinic, I had people basically put their lower back up and try to like flex just a little bit and feel that pelvis, how small of a movement it is.
Yeah.
For your abs to help your pelvis and your lower back like push into the wall. It's very small and it's very subtle. It's very easy to be like, yes, hind end. It's all about the hind end, and tell a horse to go faster. But if you don't have that crunch, none of it works.
Yeah.
You know?
So I love that. It's not about going faster. Right.
Yeah.
I love that.
You can go fast.
Yeah.
Very crooked.
Yeah. I love that. That's a great distinction. Yeah. And that's something we should talk about in a later deal.
Yes, apparently we've been chatting for a while, so we better wrap it up here.
Yeah, and kudos again to all the participants and those that brought horses. that is lovely to see, because the human wants to do all they can for the horse. And so just kudos to them for participating and allowing us to work with their horses. And we got a lot out of it, and I hope they did too. And yeah. Thank you to them.
Yes. All right. Well, thank you for traveling all the way up here to see us. And but didn't have to twist your arm too hard. It was
you really
a beautiful day up here in the White Mountains. So
it sure was. It sure was.
Yes. All right. Well, we will talk to you soon.
Sounds good. Thanks, Tamara. Okay.
Bye. Thank you for joining us. If you have questions or comments about the show, or if you have something you would like us to discuss on a future episode, we'd love to hear from you. And as always, if you enjoyed the show, please share. Vanessa and I really appreciate your support. We will see you next time.